So next thing we're going to touch on here is FEHB and Medicare. So FEHB and Part B Medicare premiums are um, something you'll probably hear rumors on or talk about. So the federal employees, uh, if you're still working, you do not have, and you turn 65, you do need to take Part A. You do not need to take Part B because you're still an active employee. When you retire, if you're 65 or older, you have the option to pay into Part B. It is not a cut and dry decision. If you elect to not pay into Part B, that's fine. Just know that you're essentially making decisions you're going to stay on FEHB for the rest of your life. And the reason is that for each year past age 65 that you elect that you're not working and elect to not pay into Part B, Medicare Part B, it's a 10% penalty. And these add up. So however many years you decide to not do it, if you, let's say you're now 70, you've been retired since 65, never paid into Part B, and you're like, hey, FEHB is getting too expensive. I need Part B, that it's a 10% penalty times the 5 years. So a 50% penalty on what you now pay for Part B premiums. You pay basically 50% more, and you will pay that for the rest of your life. So it becomes kind of cost prohibitive to make that election later. One of the things that FEHB does to sort or has done to sort of tackle this a little bit is they now have what are called Medicare Advantage plans inside of the FEHB system. So there are federal benefit Medicare Advantage plans that are designed to work with Medicare Part A and B. Highly encourage you to check into that if you're one of the people that are going to be retiring um, or are already retired prior to 65 or turning at 65, where Medicare is now going to come into play for you. So Medicare was originally added to Social Security in 1965 as a health insurance plan for individuals age 65 and older. And it has four main parts. So there's hospital insurance, that's Part A, medical insurance, which is Part B. Medicare Advantage or Medigap plans are what you would find in Part C. And then Part D is the drug coverage. Now, I mentioned Medicare Advantage plans earlier. Medicare Advantage plans are required to include vision, dental, and prescription drugs as a bundled package. So if you choose instead to get, say, a Medigap plan or a Medicare supplement plan, those may or may not have prescription drugs, vision, and dental included. So important to sort of check all those things out before you select which plan you want. Again, this is just reiterating that Part A is hospital insurance, Part B, medical insurance, in which you can see is the Part B monthly premium for 2023 was $164.90. That is the base coverage or base premium amount. If you make over a certain amount of money in retirement is earnings or are over a certain amount the 2 years prior to retire to 65 in earnings, then you could have a higher amount due as part of what they call an IRMA penalty. A little bit much to get into on this one because it's not actually a federal employee benefit, but just something to keep in mind that this is the starter amount, and for 2024 it was slightly higher than that. Part B coverage again, medical necessary services. This is your like doctor's stuff. Um, Hospital again is Part A. This is doctor offices, preventative stuff, that kind of thing. There is a deductible similar to your regular health insurance. And then you can see there's a 20% co-insurance after the deductible's met. You may hear seniors refer to this as like a donut hole. So there's just this gap in coverage, which is why you would need Part C or a Medicare Advantage plan. Also note that if you're a retired military and on TRICARE, your decisions are going to be slightly different on whether you want to have FEHB as well or carry both into retirement. A little bit different discussion there. If you're a TRICARE uh, member and are retired military, you do have to pay into Part B, assuming you're not carrying FEHB as well. So, as I mentioned earlier, Medicare Part B, there's things that it doesn't cover. Long-term care is a very, very important one. Does not include dental, eye exams, vision, dentures, cosmetic surgery, acupuncture, hearing aids, and routine foot care. So these are things that you want to try to get covered either in your uh, Medigap plan, your Medicare Advantage plan, that kind of stuff. I kind of covered most of these for you. Medicare Part C again is Medicare Advantage, Medicare Gap plans, filling in those areas that Part A and B don't cover for you. And again, when you get to 65 and are looking at retirement or are already in retirement, I encourage you to go to Medicare.gov, and you'll kind of walk through the system there. It's a government website that allows you to really kind of search the Medicare field. It'll show what plans are available to you in your area. You can put in there what prescriptions you take, which doctors you go see, and it'll recommend a plan for you and tell you exactly what that's going to cost for you to get it. All right, and we're going to touch on FEGLI here. So FEGLI is a 5-year renewable group term life insurance plan. Now, most of you probably didn't know that. This is referring to Part B and C and A. This is different than your basic coverage. So this is just A, B, and C. The coverage is actually not provided by OPM or the federal government. It's actually administered by MetLife. You might know them from their advertising with the Snoopy and the Peanuts gang. It is again, everything but basic is a term life insurance plan. So it has no cash value, no loan value, um, and it's designed to basically go up in cost again every 5 years for you uh, until you kind of retire. Once you retire, the amount of coverage you have reduces by 2% every month until it goes away. So, and you do pay for it in retirement. And if you've kept it that long, it gets very expensive. Types of FEGLI coverage, again, you have your basic coverage. Anyone basically under age 45 also has what's called extra FEGLI coverage. Now, basic FEGLI coverage, if you're a postal employee, is at no cost to you. If you are any other federal employee, then you pay a portion of the coverage. Some of it's paid by the federal government for you. And the way they calculate your basic is they take your salary, they round it up to the next thousand, and then they add $2,000 to it. Now, you got to remember that when FEGLI was created, uh, $2,000 was a lot of money. They've never adjusted the amount or the formula really for what you get. So I'll give you an example. If your salary is $97,500, they round that up to 98,000, add 2,000 to it, and your basic coverage in this example would be $100,000 of coverage. So it is driven by your salary, and the pricing on this only goes up while you're working anyway. It only goes up by any sort of pay increases you receive, whether it's step and grade increases or cost of living adjustments. Options A. So option A is a flat $10,000 in coverage. Option B is from if you elect it is 1 to 5 times your salary. You can pick any of those multiples there. And then option C is like the family coverage. And so again, 1 to 5 increments that you can or units that you can purchase here, and they cover your spouse and kids. FEGLI basic coverage rules. Again, it's automatic for you. You can opt out of it. I don't recommend it because it's not expensive, and you should I mean, I definitely recommend people carry it. There's no health questions to qualify for it. And the reason that the basic is different is there is the option to keep some of it in retirement, which we'll discuss as well. The kind of went over this part for how much you actually have. Your extra basic coverage, again, if you're under 45, um, it's provided to you at no additional cost. And so 35 and under essentially is two times your extra basic coverage is just an additional salary amount for you, basically. So again, if your salary, let's say your basic coverage calculated to 100,000, then the extra would be another 100,000 if you're 35 years and under. Once you hit 35, from age 35 to 45, that amount drops, that extra coverage amount drops by 10% per year. So in the example I'm using here, where you had $100,000 extra coverage, at 36, it would be down to 90, then 80, 70, 60, 50, all the way until it's gone at 45. So from 45 on, 45 and older, you don't have any extra coverage. And so this is just sort of an example of kind of how all that was calculated for you. So FEHB basic coverage, the way they price it is it's 16 cents per pay period per $1,000 of coverage, regardless of age. Comes right out of your check. You pay, and this is if you're not a postal employee. So there's regular federal employees, 16 cents biweekly per $1,000 of coverage. You're essentially paying 2/3 of the cost. The government pays a third. If you're a postal employee, again, your union basically negotiated it. You have no cost for your basic coverage. So at age 65, or retirement age, whichever's later, your basic coverage will start to decrease. If you've so let me back up. When you retire, whether it's pre 65 or 65 or older at retirement, the you'll have options to keep it all. You can do a 75% reduced or a 50% reduced. So it's important to know, because if you choose a 75% reduced, which basically means you're keeping 25%, from age 65 on, there is no cost once you're retired. There's no cost to you for that 25% you're keeping. Um, I don't want to use the word free, because you kind of prepaid for it, if you will. I mean, you paid in during your working career, but there's no additional cost. And so that's super important, because it's the best type of life insurance that you can get, certainly at that age, because you're not paying anything for it. And that will stay in place for the rest of your life. So if we use the example that your benefit was $100,000 in full, the keeping 25% or 75% reduced, as it's worded on your retirement paperwork, would leave you with $25,000 for the rest of your life. So I like to call it an enhanced burial policy. It should be enough to kind of put you in the ground, pay for flowers, that kind of thing. Now, if you want to keep 50%, then that $100,000 would get dropped to $50,000, and you're going to pay a premium that accounts for you getting some of it for free. So this is sort of an example. So this is, again, 75% reduced. It is going to drop by 2% a month once you turn 65. And then you pay 32.5 cents per $1,000 of coverage to age 65, and then nothing after age 65. So I hope that makes sense. But if you retire at, let's say, 62, and you decide to keep this, you're going to pay a little bit for it until you're 65, and then 65 on, there's no cost. And what you pay is 32.5 cents per thousand. Now, I know that sounds quite a bit more than the 16 cents we were talking about earlier, but you're paid, the 16 cents is based on bi-weekly paychecks, which there's 26 pay periods in a year. This is based on monthly, so it's actually the exact same rate. So that's 75% reduced. 50% reduced, you pay $1.03 per thousand to age 65, and then 71 cents per thousand from age 65 on. And that's again reflecting that you're getting a portion of it for free. No reduction basically means you're keeping all of it. You pay $2.45 per thousand to age 65, and then $2.13 per thousand from age 65 on. That's pretty costly. I don't see a whole lot of people take that. The only kind of exceptions to the rule would be if you maybe you were terminally ill or had cancer or something like that and couldn't get insurance anywhere else and wanted to have something in place, then you could certainly, pay a little extra and keep it. The premiums for these are taken out of your actual annuity payments. So the FEGLI optional coverage, as I mentioned, you have uh, the A, B, and C part. You can only opt in or make changes to that coverage at very specific times. So new employees get to sign up for that coverage. Um, they have to have basic at least, but they can opt into the other pieces when they're hired. They have basically 60 days to do that. Um, if you become regular, let's say you started as a part-time uh, worker or seasonal worker or temp or something to that nature, and then you get promoted to regular, that is opens up that 60-day window for you to be able to opt into the FEGLI coverage. Um, and you want to be aware of that because they're not going to like track you down to make sure you did it. They're going to mail you an enrollment booklet or give you access to your online enrollment site. And whether you choose to take it or not is up to you. But after that 60-day period, there's only a few times that you can go in and make that change. And so those changes would be marriage, divorce, birth of a child, or death of a spouse, death of a child. Those do allow you to go in and make changes at that time. But again, you have a small window at that point. There are occasionally, it's usually, last one I think was about 7 or 8 years ago. FEGLI will have an open season. If they do ever have an open season, then that is another period of time in which you can make those changes. Please don't confuse this with your annual enrollment period for health insurance. It's not the same. This is a FEGLI open enrollment season. We briefly touched on this earlier, but FEGLI option A is a flat $10,000. Um, it it does allow you to keep that if you just like with the basic coverage where you can keep 25%, you do get to keep 25% of this if you want um, from age 65 on, and then you can keep that for free from 65 on as well. So it's a little bit extra you can kind of add to that burial policy I mentioned earlier. So this is the kind of showing you an example of how that cost works. So um, if you're under 35, it's 20 cents biweekly. This column over here is showing you monthly, so that 20 cents equates to 43 cents a month. This does for after age 35, it goes up in 5-year increments. So from 35 to 39, you can see it's now 30 cents, and 40, then 70, then $1.10, then 2, and then $6 from age 60 to 64. This does get pretty costly out here. So not everybody keeps it, but kind of important to know how it works. Option B is 1 to 5 times your salary, rounded to the next $1,000. So you do pay the full cost for this. Um, this is that same kind of coverage that goes up every 5 years, like the other one. And then, once you are 65 years of age, it does decrease by 2% a month for 50 months until it's gone. You do have the option to keep some of this if you want in retirement. I've never seen anybody do it, but it's very expensive to do, but they do allow you to do that depending on how old you are. And so this is probably a little tough to see, but because it's kind of small numbers here. But what I want to highlight here is, again, this is biweekly cost. This is your monthly cost. And so before age 50, it is very, very low cost insurance. It's probably some of the cheapest life insurance you can get, especially with no medical questions being asked. So you can see under age 35, it's 2 cents biweekly per $1,000. At age 40, it has now gone from 2 to 4 cents. So it went from 2 to 3 to 4 cents. So double original, but still relatively cheap. It's basically 8.7 cents monthly calculated out. What I'm going to bring to your attention from age really 45 on is you're going to see it starts to double or almost double every 5 years. So it goes from 4 to 7, then 7 to 11. Then at 55, you're up to 20 cents per thousand. Then at 60, it goes to 44 cents per thousand. So that's even more than double. Um, give you a little bit of a break, if you will, at 65. They only went up 10 cents on you there. But then at 70, it goes from 54 cents to 96 cents per thousand. Now, I'll be honest with you, most people have dropped it before now because it's very expensive if you kind of do the math on how much coverage you have. But you can see it keeps on going up until you're age 80 and over, at which point it's $2.40 per thousand per pay period. Now, at this point, you're probably on your pension and paid monthly, which you can see is $5.72 per thousand from age 80 on. So again, the only reason that people generally carry this into retirement is if they're terminally ill, uninsurable, and need coverage at that point. Option C is that family coverage I mentioned to you. It's measured in units, 1 to 5 units. And for your spouse, each unit equates to 5,000. So you can pick from anywhere from 5,000 to 25,000 in coverage. If you choose that, you also get child coverage with it. So these aren't like a la carte. It's you if you pick 1 times, you're getting 1 times for your spouse and children. And it doesn't matter if you have 1 child or 20 children, they're all included at the same price. So 1 to 5 units at $5,000 a piece for your spouse, $2,500 per unit for each child that's under age 22. Employee pays the full cost. It does adjust by age in those 5-year age brackets. One of the things a little quirky here is that even though the coverage is on your spouse and kids, it increases based on your age, the employee's age. So, and then it also decreases 2% per month until it goes to zero after age 65. You can keep it if you want to keep paying the premium. One thing I will point out here is that if you are single but choose this option to cover your children, FEHB will not notify you when your children age off of this plan. So you need to be aware that when your kids age out, turn 22 or older, you need to drop this coverage, which they will allow you to do. So this is the cost page. Under 35, it's 22 cents per unit biweekly. And it goes up from that point on every 5 years. So you can see 22, 27, 41, 59, et cetera, et cetera. This is per pay period. This is per month. So just important to kind of keep those in mind. This is a sample of kind of what your coverage options would be and kind of how they calculate it out there for you. Again, this is an area that if you're concerned with what you should have or what you should keep, I highly encourage a conversation with a financial advisor. If you opt into the free one-on-one meeting that I mentioned at the very beginning here, we definitely can go through this with you and help explain the cost in pre-retirement, into retirement, kind of how all that works to help you make the best decision for you. Again, this is just a sample of kind of how it's calculated out for you. And another one here. You can see this can get kind of costly. So on FEHB, as I mentioned earlier, you do want to make sure that you have your beneficiaries filled out. To do that, it's a form SF2823. All these forms can be pulled either by going or get acquired by going to either HR, or if you go into the opm.gov website, and in the search field, just type in SF2823. It'll pop right up. Again, you definitely want to do that at some point and make sure that your beneficiaries are correct there. If you want to drop your coverage or decrease your coverage, you need a form SF 2817. They will let you drop or discontinue it without one of those qualifying events happening. They just won't let you add or increase coverage without one of them.